Thank you for taking the time to watch this video regarding a new diagnostic test for Bendaii syndrome. Through this presentation, I will be highlighting the data found in a sample of 10,000 patients using this diagnostic testing. This new test offers a painless, inexpensive way to quickly diagnose Bendaii syndrome. Previous testing was more invasive and took longer to interpret the results. By utilizing a bedside ultrasound with intravenous dye, we are able to visualize the infectious disease and perform interventions immediately. Let's take a look at the data. As we are all well aware, sensitivity refers to the ability to correctly diagnose an individual as diseased. For this test, the sensitivity is 91%, which means for 91% of patients they are correctly diagnosed as having Bendaii syndrome. And as sensitivity and specificity are inversely related, it is not a surprise then that the specificity for this test is at 15.8%. This test produces high sensitivity for the results, which means that the test will catch 91% of people with the disease correctly, while the low specificity will result in an increased number of false positive results for those who don't have the disease and should have tested negative. We would rather have false positives than miss a diagnosis. We know that the morbidity and mortality rate for Bendaii syndrome is high. That warrants the use of high sensitivity testing in order to ensure that we are not missing patients with this disease. Catching patients as quickly as possible is also key to treating Bendaii syndrome. This new diagnostic testing would allow us to identify patients with Bendaii syndrome much quicker than the traditional method of laboratory testing. This will enable us to start antibiotic treatment right away, which we know decreases the risk of morbidity and mortality if we are able to treat the disease within the first 4 days of onset symptoms. Okay, now moving on to positive predictive value for the test. The PPV came out to be 14.9%. We know that PPV is the percentage of patients with a positive test who actually have the disease. We would expect this lower PPV as the test has low specificity and includes a large number of false positives. However, this is balanced out by the negative predictive value, which is at 91.5%. This shows that we would not be missing diagnoses, as we would correctly categorize patients with the disease in a negative testing for 91.5% of patients. This is also reflective of the prevalence of Bendaii syndrome in the population. With the prevalence of Bendaii syndrome decreasing in the population, the PPV would decrease as well, while the MPV would increase. After performing the diagnostic test, you should explain the results to the patient. If the patient receives a positive test, please advise the patient that while the result has returned positive, we will wait to see how they react to the antibiotic treatment and perform subsequent serologic testing to confirm the diagnosis. The conversation with the patient must stress the diagnosis is not absolute until further testing. Providers must be mindful of explaining positive test results to patients, as this can understandably cause undue stress if not explained correctly. This new diagnostic test offers a painless, inexpensive way to diagnose Bendaii syndrome. With this testing mechanism, we will be able to quickly diagnose patients at the bedside and start the necessary treatment. We anticipate an increase in diagnoses and utilization of appropriate antibiotics. We also anticipate a decrease in morbidity and mortality due to Bendaii syndrome. And with that, I thank you for your time today.